We get a weather update at 11 o'clock from the Met Office through to our gritting controller at Newark. He'll relay that message to the four foremen, which I'm one of, and then we relay that down to our crew that we are in charge of. That'll give you the time that we're supposed to be in the yard, the spread rate that we're supposed to be spreading at, and the weather forecast and what they're expecting and what time we're going out due to the weather. We go out with a said lorry full of salt, could be up to 10-12 tonnes on the back, and away you go. You spread it down, and you want to be putting it down a couple of hours at least before the forecast if it's going to drop cold, to help the traffic crush it down into the tarmac. And then hopefully when it goes freezing, it'll not freeze, it just moistens it up again nicely. It's all down to the weight of the traffic and everything else. It's quite a pleasure to be out there. You know you're doing the best that you can. You're putting the salt out there. You're trying to make the road safe. You're just in your own little world. You know what you've got to do. You put the radio on, heater's nice and warm, and you're away and enjoying it, and off you go. It's peaceful.
The three words I'd use to describe my role is team, rewarding and challenging.
Positive, team, supportive.
Three words I'd use to describe this job: gratifying, inspirational, challenging. Before this, I was a hairdresser, but I wanted to do more than make people feel good. I wanted to help change their lives. I'm now part of a team that does exactly that every day.
I spend my days talking to the residents of Nottinghamshire, their families, and the support services that help them on a day-to-day basis. We're the front door to adult social care in Nottinghamshire, and we're responsible for taking the time to build a picture through talking with our residents about how they lead their lives, the things that they find difficult, the things that they can do, and also looking at how they wish to fulfil their lives to the best of their possibilities. In the 5 years of working here, I've learnt so much, particularly about social care. I had no previous experience in it, but through a really good training and induction plan, I was given all of the skills and information that I needed to be able to do my job. I've also been able to grow personally and within my career since then through a personally tailored plan of support and training to keep me going.
We're a really close-knit team, and we thrive off helping the community of Nottinghamshire to live a valued and independent lifestyle. Every day is different, and there's always new things to learn, which makes the role interesting and really exciting. At the end of the day, knowing that I've helped a number of people to have a better quality of life makes every day worthwhile.
This winter, more than ever, with COVID-19 still circulating, we need help to reduce all avoidable risks. You can help protect the NHS, social care and loved ones by getting the flu vaccine. You may be eligible for the free vaccine at your GP or local pharmacy if you are over 65, pregnant or have a long-term condition. Find out if you are eligible at nhs.uk/staywell. Children up to year 7 can get the free nasal spray at school or through their GP if they are below school age. If you are not eligible for the free vaccine, you can pay for it at your local pharmacy. The flu vaccination does not give you flu. It reduces the risk of catching flu, as well as spreading it to others. If you had the vaccination in the past, that will not protect you as the flu strain changes every year, so you need to have a new one this year. It is also important to wash your hands often with warm water and soap. Use tissues when you cough or sneeze, and bin used tissues as quickly as possible. Thank you for helping to protect yourself and loved ones this winter.
The 3 words I'd use to describe my role is team, rewarding and challenging.
Positive, team, supportive.
3 words I'd use to describe this job: gratifying, inspirational, challenging. Before this, I was a hairdresser, but I wanted to do more than make people feel good. I wanted to help change their lives. I'm now part of a team that does exactly that every day.
I spend my days talking to the residents of Nottinghamshire, their families and the support services that help them on a day-to-day basis. We're the front door to adult social care in Nottinghamshire, and we're responsible for taking the time to build a picture through talking with our residents about how they lead their lives, the things that they find difficult, the things that they can do, and also looking at how they wish to fulfil their lives to the best of their possibilities. In the 5 years of working here, I've learnt so much, particularly about social care. I had no previous experience in it, but through a really good training and induction plan, I was given all of the skills and information that I needed to be able to do my job. I've also been able to grow personally and within my career since then through a personally tailored plan of support and training to keep me going.
We're a really close-knit team, and we thrive off helping the community of Nottinghamshire to live a valued and independent lifestyle. Every day is different, and there's always new things to learn, which makes the role interesting and really exciting. At the end of the day, knowing that I've helped a number of people to have a better quality of life makes every day worthwhile.
I can really recommend being a foster carer for Notts County Council. There's always someone walking the journey alongside you, whether that's other foster carers or
Good morning, everyone. I'd like to welcome you all to this meeting of the Adult Social Care and Public Health Committee, which is being held remotely, broadcast live and recorded for publication, with the majority of the 11 members, in fact all of the 11 members, joining the meeting from their own homes. I'm Councillor Tony Harper and I'm the chairman of this committee. For the benefit of the viewers of the live stream, I'll now ask the clerk to the committee, Joe Toomey, to list the other members and officers present today. Over to you, Joe.
Thank you, Chairman. As well as yourself, we have Councillors Bosniak, Dr John Doddy, Elliott, Fielding, Martin, Purdue-Horan, Sissons, Vickers, Vice and Woodhead. And as well as myself, we've also got the following officers present today. The Corporate Director, Adult Social Care and Health, Melanie Brooks, Consultant in Public Health, Kath Pritchard, who's here on behalf of Jonathan Gribbin, Service Director, Living Well Community Services, Ainsley McDonnell, Service Director, Sue Batty, Director of Transformation, Grace Natoli, Group Manager, Contracts and Performance, Natalie Burkett, Project Manager, Service and Improvement from the Service Improvement Team, Lindsay Adams, and Senior Executive Officer, Jenny Kennington.
Thank you, Joe. We'll now move on to item 1 on the agenda, which is the minutes of the last meeting from the 11th of January 2021. And you can find that on pages 1 to 6 of your agenda pack. Has anybody got any problems with the minutes? Right, I'll take that as an assent. So that is passed, thank you. We'll move on to item 2 on the agenda, apologies for absence. Committee clerk, please.
We've not received any apologies today, Mr Chairman. All members are present.
Thank you very much, and thank you all members for attending. Move on to item 3, declarations of interest. So do any members or officers present have any disclosable pecuniary interest to declare? And do any members or officers present have any private interest, which is either pecuniary or non-pecuniary, to declare? Thank you. I've got no hands up. Like I always say at this point, no problem. If you get to an item where you do feel that you've got a declaration, then just make it then. That's fine. Thank you. Move on to item 4 on the agenda, which is the Adult Social Care and Public Health Department's digital strategy for 21 to 2024. And you can find that on pages 7 to 18 in your pack. So the report seeks approval for the proposed approach to the development of an adult social care and public health digital strategy and plan for 2021 to 2024. The need to develop a digital strategy was identified as a work strand in the Adult Social Care and Public Health Service Improvement Programme for 2021-22 to 23-24. This was presented to the Adult Social Care and Public Health Committee on the 11th of January 2021. This report sets out the proposed approach that will be followed to better understand the department's digital requirements and to develop the strategy. The recommendations for this report are set out on page 14 of the agenda pack, and that is that members of the Adult Social Care and Public Health Committee, 1, approve the proposed approach, themes and principles to be adopted for the development of the Adult Social Care and Public Health Digital Strategy as detailed in paragraphs 18 to 20 of the report. 2, give permission for the engagement and co-production with stakeholders of the 8 themes described in paragraph 19 of the report. And 3, to agree to receive a report on the co-produced digital strategy and plan at the June 2021 Adult Social Care and Public Health Committee meeting, which is ahead of the strategy being submitted to the County Council's Policy Committee. So I formally move the recommendations. Do I have a seconder, please?
Happy to second that.
That's Councillor Boyd Elliott. Thank you. Grace Natoli, could you introduce the report, please?
Yes, thank you, Chairman. The report really sets out, or it gives a bit of a context in relation to the work that the department has been doing up to this point. Prior to the approach we are proposing to take, the department did some work between 2017 through to 2020 to try and bring together the work we were doing in terms of digital innovation. And certainly from paragraph 3 to 5, gives you a sort of a bit of a flavour in terms of what the department had tried to achieve. Paragraph 5 talks about the benefits of what had been implemented during that period, certainly between 2017 and 2020. Now I think we're at a point where, based on the pandemic in particular and the learning that we have had from that, we want to focus particularly the work that we have started in terms of thinking through in a much more structured way through a strategy to make sure that we have a plan that we need to implement over the next few years. The COVID response, like I say, has meant that we have had to support people in a different way, and through that, there's certainly been some learning that we want to take forward, and has emphasized that other than the more traditional ways that we support people, digital actually does play quite a key part in enhancing the way we support people that require social care support. At the last meeting, we talked a little bit about some of the work that we are doing in the background around the COVID response, which is to do with the digital device scheme that we have been developing, and certainly from paragraph 12 through to 16 talks about in a bit more detail, as Members had asked for. Talks about in a bit more detail in terms of the lending and the gifting scheme that's being developed, primarily really to support people, prevent social isolation, and also engage carers. So I'm pleased to say that certainly from the 1st of March, we will be able to actually hand out some of those digital devices and be able to engage and support people in different ways where people have not, they haven't got access to a digital device. Moving on then to paragraph 18, here we're sort of trying to outline the approach that we want to take in developing this strategy. And at paragraph 20 is primarily the principles that we want to take forward in developing this strategy. But core to this, I think I just wanted to emphasize the point of the core production in developing the strategy, that it's not something that's going to be done in isolation, but we're going to certainly involve different people who use services, people we support, carers, and staff, providers and partners as well. At paragraph 19, we have identified certainly some themes which we're going to sort of develop in much more detail, and depending on the sort of the group, certainly if I talk about the four key boxes there around citizens, people and carers, the workforce, partners and provided, those particular groups will be core to helping us shape what the strategy needs to look like in terms of what they would expect to see in relation to it. At paragraph 22, we've just given a high-level plan really in terms of how we propose the timelines to look like to develop the strategy before we then come back to committee prior to going to policy committee, because we want to make sure that A, you're cited on it, and B, you're happy with what we are proposing going forward. And the final point I was just going to make is under the appendix, really, which can be found on page 17. The appendix outlines or details what it is that we are trying to achieve through this strategy. So earlier I talked about in terms of the themes that we are seeking to develop further, but actually the appendix gives you a flavour of what it is that we are trying to achieve through the strategy. So, you know, that's all I wanted to kind of highlight on, Chairman, and very happy to take any questions that members may have. Thank you.
Thank you, Natoli. That was very well explained. Thank you. Any questions? I've got Councillor Steve Vickers, please.
Thank you, Grace. That's excellent. We've all had to speed up our knowledge of technology one way or another over the last well, it's a year now almost, isn't it? And I just wondered whether, for the service users and staff, it speeded up such a pace. Has there been any unintended consequences of imposing more of a digital technology than perhaps the knowledge and the understanding was there initially?
Yes, I would say that certainly for staff, potentially, yes, there has been some unintended consequences, but from a corporate approach, I know that certainly corporately, the approach that's been taken is to ensure that there's different support mechanisms for staff. So, of course, you know, we've got our IT help desk, for example, on the intranet as well. There's different guidance, and I know that certainly the IT team do different surgeries, if you like, online that people can tap into. So yes, it's been forced, but I don't think we had much choice in relation to it. But the unintended consequence has been that people have had to learn quite quickly, but at the same time making sure that there is support for staff in particular to make sure that they can access or can work as effectively as they can. In relation to people that we support, certainly in relation to the scheme that we are proposing to implement, we will be putting, or we will be working with a partner to make sure that that people feel reasonably comfortable and feel supported and understand the functionality of the devices if they get stuck at any point. So they have the help at their fingertips, either through a phone call or different means still, again, to be developed further. So whilst the unintended consequences may be there, what we are trying to make sure is that there is the relevant support that we give people to make sure that they're making the best use of the technology that's available.
Thank you, Grace.
Thank you. I've got Councillor Muriel Wise and then Councillor David Martin. So Councillor Wise, please.
Thank you, Chair, and thank you, Grace, for an excellent and very timely report to move us on. I'm glad to hear about the support for staff, because I think some of the feedback from people can be, as it sometimes is when we go to our GPs, that they have their head over the computer and are not looking at me and really taking in what I'm saying. So, you know, that skilling up is very important, isn't it, really?
Yes.
Just recently, I sat with a resident who was struggling with the questionnaire she had to complete for applying for both continuing healthcare and social work support for her mother. She's an intelligent and articulate woman, but she had really struggled with the document, and in fact, had not been successful in her first application for the funding. So this was a sort of a second hearing. And she went through the questionnaire that she'd completed. Mm-hmm. And it was a positive outcome. But the discussion was very nuanced. You know, sort of the difficulties she was facing in answering the questions, the qualifications she wanted to put to what she'd written on the paper. So I just wondered how we're going to find the balance between that kind of face-to-face discussion, which can move things on very positively, and the probably the more substantial area of work that perhaps can be done on the phone or on computer. And in the light of that, I wondered what you have in place to make a judgment about how effective any of the changes, how they're going to be assessed to see that there aren't the unintended consequences that have become negative. But will there be ongoing evaluation, or how will you approach that? Thank you.
Thank you, Muriel. Grace?
Yes, thank you. I'll probably answer the latter part of your question first, and if I may, I might bring in my colleague Sue Batty around the continuing healthcare questionnaire. But in relation to ensuring the sort of the success, one of the points I made earlier is that with the development of anything, co-production will be absolutely key. So we will take the responsibility to make sure that whatever we develop it alongside people rather than in isolation. And as part of the process, we will certainly build in some form of evaluation at different points to make sure that whatever we implement or whatever we propose to implement is making the impact that we are seeking for it to do. So, going back to that appendix of the report with the key elements that we are trying to achieve out of that, we should be able to measure against that at different points, either through conversations with people, through what I would hope to be a much more simplistic questionnaire rather than the CHC questionnaire scenario. But yeah, certainly I think evaluation will be a key part of that, and certainly through the co-production will ensure that we have that conversation with people in terms of, what would be the success criteria, or what does success look like for them. So I just wondered whether you wanted to comment on the continuing healthcare element of the questionnaire, please.
Yes, I'm happy to. So I think the continuing healthcare process and looking at eligibility can be quite a complicated and confusing time for a lot of people. So we are working with a number of people. If you remember, the pandemic meant that we put those assessments on hold for a while. So we did put some new paperwork in place to support that. But what I'm hoping to do is that once we've done a lot of that work, we'll review it, and we'll review it with some people that have been part of the process, so that going forward we can see if we can make it a bit more simple again, and pick up some of those points that people have found difficult.
Yeah. Just one final point from me, just in reference again to the appendix. One of the things we're looking at is around digital social care. So, those online assessments, us, giving people the capability to do some assessments online, but taking into account, of course, what you've just said, Councillor Wise, in terms of developing some of those questions or the questionnaires, making sure that people really understand, but we would want to bring them along the journey rather than being done to. We would want them to be part of the process as we develop what that looks like, and of course taking into account what our statutory obligations are in terms of some of those questions. But at least we want to make sure that people people have a much more friendly experience in completing those questionnaires online, potentially.
Thank you, Grace. Okay, Muriel.
Just to, if I may, Chair, just to ask, I see that May is down as a time for a report to come on the basis of a co-production consultation and engagement. Is that realistic, given the present restraints on communication?
I think that the timeline is, we can use that as a, let me just go back to the timeline, bear with me. So in terms, that's pretty much the activity that we are doing between February and May. So, you know, having the engagement and the co-production and starting the development of it. So it's work that we can be doing in the background. So if it's in relation to the timescale, if you're suggesting that that might be shorter time, then I think we just need to really look at that to see how can we realistically achieve what we are setting out to achieve within it. But we've given ourselves a bit of flex that, you know, if we need to extend a little bit more because of, as you say, because of the restrictions, and then we would have to do it differently. And of course, the you know, some of that co-production, we're having to do co-production in a very different way than we used to previously. So, you know, we'll utilize Microsoft Teams, for example, the use of questionnaires as well. So, you know, I'm hoping that rather than, rushing it, we'll take a view as to whether we get what we need within that timescale. And if we need to extend it a bit more, we've given ourselves some flex within the timescales.
Excellent. Thank you, Grace. I wish you well with it.
Thank you so much.
Thank you. I've got Councillor David Martin, then Councillor Joyce Bosniak. So David, please.
Yes, morning everybody. Thank you, Grace. It's an excellent paper. NHS jargon free. Thank you. Yeah, it really is good, and it just shows you what a fantastic piece of work it is, and so timely appropriate as well. I'm so glad we started it back in 2017. When I look at this paragraph 4 on page 7, where we initiated 70 digital projects, and of those 18 have been delivered and 31 are implemented. That's a fantastic achievement in such a short space of time, given the colossal scale of it. A couple of things. One is I would have liked to have seen an appendix with the others that are in implementation and those that are progressing. That's what I would have liked to have seen, because I'm always curious about what I can't see. The other thing is as well, I mean, the appropriate timing of this is such a great piece of work, and of course it's very clearly laid out in this paper. One question I have got is when we do come to what do you call it, lending and gifting. Yeah, lending and gifting scheme. Will there be some kind of returns policy issued to the people who receive this equipment? Because obviously it's 62 grand's worth of equipment, and a lot of these people aren't going to keep them for a long period of time. I know some people will, but you know what, I just wondered what the policy was on that, like you would have, you know, like a toilet frame or a Zimmer frame, the same kind. Are we implementing some kind of returns policy? So I think that's about all, apart from to say what a great piece of work, and I'm looking forward to it being implemented. Thank you.
Thank you, Grace.
Thank you. Yes. So in terms of the appendix of some of those projects that have been implemented, happy to share that with members, so we can send that separately if that's helpful. In relation to the lending and gifting scheme, yes, so it's a bit of a combination actually. Some of it is gifting and some of it is lending. The reason for that is that with any referral for a device is going to be linked with you know, achieving of somebody's outcomes. So for example, through conversations with their social care worker, if the person either, you know, is shielding for much longer period of time, say for example for more than 6 months from the point of having their device that they can't mix within the community at the appropriate time, or they can't go to, I don't know, a day center as they normally would, anything over and above 6 months would be gifted. and anything underneath that would be through the lending scheme. And colleagues certainly within commissioning, legal and IT have been working very closely together to come up with what that looks like and what some of those agreements look like. So yes, for some they will be returned, but for others they won't be, on the basis that I think, well, the experts tell us that, with a device that's been utilized for, say, for 6 months onwards, returning it, you might as well either buy a new one, just because of the life cycle of them, and for whatever it is that they may be used for. And of course, if something is gifted to someone, it highlights that they need that support for a much longer period of time than somebody, for some, for example, one of the things we're using it for is for where people are trying to find employment, being supported to find employment and so on. So that's a reasonably short period of time to sort out their CV and attend interviews via Microsoft Teams and so on. So once that's finished, then they need to give it back. So, in a long-winded way, what I'm saying is it's a combination of gifting and lending on that basis.
Yeah, if I may, Chair. Yeah.
Yep.
Yeah. Thanks, Pat. So, I'm not being pedantic. So what I'm getting at is we will have some kind of structured policy, clearly setting out the difference between lending and gifting.
Absolutely, and there will be, and our colleagues in procurement and legal would not let us get away with that one. So yes, absolutely.
Okay, yeah. So we'll see that policy at some point then.
Well, if that's what's required, then we'll make sure that members have sight of it, if that's helpful.
Well, I think it would be, because it would allow councillors to understand the format of the relationship, of how you differentiate between gifting. I can understand what you're saying, but we need it clearly written down so that we can see it, so that we can understand, so that when residents come back to us and say, "You took it off me."
Yes, of course. Yes, of course.
All right.
Yeah, we'll make sure you have sight of that.
Okay. Cheers. Thank you.
Thank you. Yeah, when we had the pre-agenda meeting, we raised this, and there will be a robust risk management strategy on it. But like you say, Councillor Martin, it would be good to see it when that's been formulated. But I was happy that the system they put in place was a good, robust one. So thank you for that. Councillor Joyce Bosniak, please. Joyce.
Thanks, Chair. I've got one question, Grace, and then just a comment to make. And my first question is on page 8 under C, data analytics. And I wanted to ask a question about how successful we'd been in accessing health information. So when we have this system in place, are the health service putting information in there for us? I mean, you'd have to explain how this works to me. Because one of the problems we've always had is getting health information about the people that we're seeing. So I want to be absolutely sure that health are playing their part in this, because unless they do share information, then I think we're going to struggle to make it work as effectively as we could do. So that's the question about how you're getting on with that. And then the other one is just a note of caution, really, because whilst I can see what you're trying to do with this, and I think it's fantastic that you've achieved so much in such a small space of time. And I'm grateful for your input on this, Grace, because I think it needed a fresh pair of eyes looking at it, and you've been able to do that remarkably successfully. But once we start to go, I don't want to go too far down the digital route, because my concern is we're dealing with vulnerable people who rely heavily on their carers, and carers are fantastic. They do a brilliant job. However, there's always the scope for one or two carers not to be as honest and open as they might. And because we have so few, I would hate to see home visits stopped. I know we can't do it at the minute, but once we can, I would hate to see those stopped, because that's the only chance we get the opportunity to speak to the person receiving the service. Because you're going into someone's home, you can assess how they're being cared for, etc. So I'd be very worried if we went too far down the digital route, and just spoke to people over the telephone or via Zoom or Teams or whatever, because you're not getting the full picture of it. So that's just a note of caution. I'm really happy with the report. I really do hope that Health give their information so it will work more effectively. But the note of caution is we can't let go of seeing people face to face when we're able to do so. Thank you.
Thank you. Grace, did you want to comment on that one?
Yes, of course. So in terms of the caution, yes, absolutely. So with the digital is a tool that will be used alongside, not instead of. So absolutely, it's not something that will replace, that we would want to replace. I don't think we can get away with it anyway, to replace that sort of human and face-to-face contact. So it's just a complement in terms of some of the support that we need to give people, like I say, especially during these times where we can't mix as well as we would like to because of the restrictions and so on and so forth. And we've been quite specific about what what we need to use the digital for. So it doesn't replace part of our responsibility, but it's to complement some of the work we already do. In relation to health, sharing information, yes, certainly our colleagues within IT have worked really hard with health to make sure that that happens. The glitch we've had, actually, we have got access to the information and it's there available. So what we're focusing on now, it's not a glitch as such, I shouldn't have called it a glitch, but what we're focusing on now is to make sure that our staff know how to access that information, that the information is there for them to use. So there's a piece of work certainly that I'm sponsoring alongside colleagues to make sure that we have almost like a clear marketing and engagement plan for our staff, so they know where to find the information before they either start making a phone call to different places within health. Is to sort of say, you've already got this information available here, this is where you find it, and so on. So in terms of take up, that's what we are focusing on. But working with health, I wouldn't say it's been easy, but to achieve in terms of the analytics and stuff, we have managed to do that. The more work we need to do is now with our staff, so that they understand the type of information that's available to them as they work with people trying to support them.
Thank you. There are no more speakers, so we'll now move to the vote. In order to make the voting clearer for each agenda item, I'll ask Joe to read out members' names alphabetically for them to confirm whether they're voting for or against the recommendation or whether they are abstaining. So, Clerk Joe Toomey, please.
Thank you, Chairman. And just to clarify, that while today's votes will be taken by roll call, they won't be recorded votes in the minutes of the meeting unless 2 or more members request it, in line with the Council's usual recorded vote arrangements. Councillor Bosniak.
For.
Councillor Dr. Doddy.
For.
Councillor Elliott.
For.
Councillor Fielding. Councillor Fielding. Okay, I'll come back to Councillor Fielding. Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers.
For.
Councillor Wise.
For.
Councillor Woodhead.
For.
Okay. Councillor Fielding.
Councillor Fielding's not on the participant list, Joe. She's not showing as being a member of the meeting today.
Okay, thank you. Yeah, she's dropped out, so we'll get IT to contact her and try and get her back into the call. So that is carried, Chairman.
Thank you very much. So we'll now move on to item 5 on the agenda, which is developing local area coordination support in Nottinghamshire. And you can find that on pages 19 to 28 on your agenda pack. So this report proposes to introduce local area coordination in Nottinghamshire, which is an all-age community-based project that supports people to develop their personal strengths and find solutions in their community before considering formal services. The report also seeks approval to establish 3 FTE local area coordinators within the Adult Social Care and Public Health Department, indicative Band A grade, for a period of 2 years. I'll move the following recommendations as set out on page 26 of your agenda pack: that the Adult Social Care and Public Health Committee 1 approves the development of local area coordination within adult social care and health, approves the establishment of 3 FTE local area coordinators, 3 receives a progress evaluation report in April 2022. Do I have a seconder, please?
I second that, Chair.
Thank you. That's Councillor Elliott. Over to the Corporate Director, Melanie Brooks, please, to introduce the report.
Good morning, committee members. So I'm just going to introduce the report, and Grace will be available to answer any questions, particularly on the implementation. But I just wanted to set the scene about local area coordination. So local area coordination has been around in social care for around 15 years in various forms. It's an established national network that brings together authorities who have tested this as approach. It runs alongside our 3 conversations model. So when we've talked to committee before about our culture change, we've talked about the needing to reform social work, to have conversations with people about their aspirations, their goals, and how they want to achieve them. And we've also talked about the need to build community resources, sometimes we call them assets, in places alongside that, so people have got something to tap into. And local or area coordination will help us do that, and the coordinators will help us do that. It works alongside other complementary initiatives, for example, social prescribing and link workers that you'll have heard mentioned through public health and through the integrated care discussions. So what does local area coordination do, and what do these coordinators do? Well, as we have our innovation sites in social work, we'll have a local area coordination working in the same place as the social work team to develop those resources. Now, those resources will be what the people in that area need. So you may have a social worker or indeed a link worker saying that this person requires some support. The local area coordinator will try and mobilise the community to support that person. So it might be about setting up a voluntary sector organisation. It might be about setting up a micro enterprise. So, for example, a small home care or day opportunity. It may be about supporting to meet other people who can offer some self-help and some peer support, or it might be about something else. So they will match the gaps in that service with different members in the community who might be able to help close that gap. And those gaps might be short term, it might be a short term need, or it might be something much more sustainable. But the intention is the community supports that. So to give you a practical example, so in Bedfordshire, which is a rural community very similar to parts of Bassetlaw, Newark, Sherwood and Rushcliffe in particular, where you've got very isolated towns, they have what they call village agents. So the local area coordinators identified somebody with some home support needs. There was no home care agency that was able to do the calls there, but they had 1 or 2 people in the village who were happy to provide some home care support to the person. So that arrangement was made through a local area coordination. It's that kind of thing. So what we can't say is this is a menu of the things local area coordination will do, because it depends on what people need and what people can offer. But what it intends to do is bring that together and wrap around the offer of the link workers. So that's effectively what local area coordination will do. It's a 2-year scheme. We're going to be evaluating it, and you can see that on page 4, paragraph 17. It talks about the the resources that we'll invest to get this going and to evaluate it. Because obviously, if it doesn't work, if it doesn't prevent social care need and doesn't meet people's outcomes, it won't be something we continue. But that will be the intention, really, is that we'll be able to evidence how it's enabling people's social care outcomes to be met. So very happy to take some questions that Grace or I will field.
Thank you. I've got Councillor Andy Sissons, please.
Yeah, thank you, Chairman. I was just unmuting. Right. I found that some of the report took a bit of reading over and over. There seemed to be a lot of variables. I get what you're saying, Mel, but can we be sure that these posts, if put in place, will be value for money? And a little question that I would like to add on as well. In the real life story put forward under paragraph 9, it says that the person involved was introduced by a locally elected member rather than a social worker or an officer. Will these local area coordinators be easily accessible to elected members, or will we have to go through some other route? You know, will we be able to get in touch with them quite easily? Thank you.
Okay, so if I might answer the latter question first, then ask Grace to talk about what we'll put in place of the programme to make sure we're getting value for money. So the intention is that the local area coordinators will be in a place. So although they'll work alongside adult social care and what else is there, they're sort of not owned by us. They'll know the resources and assets in an area. And I think you're quite right, Councillor Sissons, that members are assets in those areas. So it's part of that broader co-production approach to try and understand what's available. So very much so, they should get to know their patch really well. So how I would describe local area coordinators as experts in the patch who will draw upon all of those resources. As we know, some areas are resource rich, and it's quite easy then to tap people into things that are going on. And other areas we would say are sort of resource or asset poor. So there the coordinator's role is much more about getting those things going and making connections. So hopefully that makes sense. And Grace, would you mind just touching on how we're going to ensure value for money and evaluation through the programme rollout?
Yes, of course. As Melanie said, a number of local authorities have implemented local area coordination, and behind it, actually, there's a number of evaluations that have taken place, either linked to different universities or other academics in terms of how local area coordination brings value to it. The approach we are taking is doing it for a couple of years, and then we do an evaluation rather than actually just implementing it forever. So we want to make sure that obviously it's appropriate for Nottinghamshire in terms of some of the key things that we want to address. And the difference, I think, is that with some of the other initiatives that are already in place, like social prescribing in particular, people are already known either by health or by social care. With local area coordination, it's an asset actually for the community, and the emphasis is around prevention, to prevent people to get to the point of actually needing formal services. So that's where the evaluation comes in terms of adding that value. So, there will be different scenarios that we can kind of talk through to sort of say, we need to capture what the local area coordinators are doing. And if nothing was done for, however many cases that they may be helping people within the community, we would be able to quantify what that looks like. There is already known evaluations that have been done with other local authorities that, I'll be very happy to share with members, just to give you a flavour of how other local authorities have come the other way. But no local area coordination setup is similar in every scenario. So each authority, like Nottinghamshire, Like I say, that's why we want to do it first set it up for a couple of years, and then evaluate to sort of say, okay, so what is the value? You know, how are we getting the value in relation to this, in terms of making sure that people don't escalate into crisis point and needing much more, you know, formal types of services.
Thank you. May I come back just for a moment, please, Chairman?
Yeah, is it on this point?
It is, yes. Yeah, it's once again about accessing the abilities of a local area coordinator. On a personal note, just before Christmas, I was approached by a friend of a person who, a little bit like the example, was sofa surfing, some mental health problems, and at the time I couldn't do very much for this person. I wasn't able to help. So would I be able to access this local authority coordinator with a problem like that? Is it going to be easy to do that? Thank you.
Yes, absolutely. Yes, absolutely. That's the whole point of that coordinator. So, you know, taking your example there, which I think is a great example, you know, sometimes we just don't know where somebody in particular, they're not known either by health or social care, they're sofa surfing. You know, it's a great example where, you know, that person could potentially end up in a crisis point. But if they get their support early enough through the local area coordinator, actually, it prevents them getting to that really crisis point where they may need much more intensive support, which potentially, you know, costs more as well. So I think the emphasis here is more around prevention and supporting people at the right time before things get really worse for them. The other cohort of people that we would want to work with potentially, and I had an initial conversation with some colleagues within Children and Families, you know, young people leaving care would be another cohort of people where, you know, once they leave care, they don't necessarily, you know, need social care support going forward because they are now an adult and so on and so forth. So there's always this gap, you know, from leaving care through to actually getting to a point where they feel much more independent. So from everything, getting all the support they need on a regular basis, on a day-to-day basis, to actually not getting anything at all. So the local area coordination would help us do is to support or to guide that young person to get themselves to a certain point before they get into crisis, which would then result in additional social care support unnecessarily.
Thank you.
Thank you. I've got Councillor Muriel Wise and then two other speakers. Muriel, please.
Thank you, and thank you both for the report and your comments. I mean, clearly this is a good thing to try. The thing that concerns me, or I suppose I want to see how it plays out, is really what the focus of these workers will be. I was a director in the voluntary sector sort of 20 odd years ago for 10 years. And at that stage, Bassett Law was a creative CVS. And it's often quoted now as that's what we can do. But actually, Bassett Law has benefited from very good accommodation, outstanding directors who've read the signs of the times, moved with the times, embraced new developments like social prescribing. Not many other, I can't think of another district in the authority that has had that long-term series of achievements and adaptability. The district I serve is very fragmented in its community support in different wards. And I think we've seen we had at one stage at the local authority, we had they're called catalyst workers who are out in the districts enabling people who had a good idea of some sort of social support to help them create a business, and many of those grew and became very effective. Others, sadly, went out of business because of all issues about commissioning and funding and so on. Similarly with social prescribing, it's been very fragmentary, partially supported by GPs, partially understood. And similarly with the link workers whose kind of job description is hugely ambitious, but in fact often come down to being signposting people in a quite short-term way into other services without necessarily having a great knowledge of what those local services are. I don't want to be negative about, but I think we need to kind of take note of the things that have started and stopped and not really fulfilled the ambitions that yourself and Melanie have, which is helping people make positive decisions for themselves and be in the community and not go into crisis and need our services. And I just wonder if we're clear enough about what the focus of these workers would be. I can understand the things you want them to do, but where the decisions will be about where they're going to be based, because they're not going to be able to cover the rest of the county apart from Bassetlaw. And also there's the relationship with the existing community team in the county council. Where that was a very large team several years ago that was active in each locality. That's now a much smaller team with limited things they can achieve. But this concept is a kind of community work, and community networking does take time, and it does need a relatively local focus. And I just wonder where that focus will be. But it's a good start. Thank you.
Grace?
Yes, I mean, you've just hit the nail on the head there, that local, the local focus. And so I guess with other initiatives where, either organizations have come in and pretty much articulated what needs to happen. With the local area coordination, I mean, at the center of it, it will be, co-producing something with the local people affected within that particular area. So we are saying, this is what we can offer at a high level. We are trying to make sure that people feel supported before A, they reach crisis point, and B, they don't have to be known by either health or social care. They just have to kind of have an issue identified, which potentially that issue, if left alone, could escalate into something worse. So that's one element. The other element is that, the sort of working in partnership with all the different organizations that you've talked about there, Councillor Wise. So, we won't be doing this in isolation. So, within that local community, working with health, working with community leaders, working with faith groups, working with local GPs, the emphasis being local within whatever area, and actually asking people what it is that they want to develop for their particular area. That's the difference, I think, and making sure that we're going in to support people with particular issues. And, those local groups, either community groups, faith groups, and so on and so forth, they know what's happening within the community. And of course, yourselves as councillors as well, you know what's happening within the community, and as a consequence, we want to make sure that people are supported at the local level, but also complementing the community teams and other work that's already happening, rather than this sort of disjointed approach that we may have seen elsewhere or in the past.
Thank you, Grace. Move on to Councillor Joyce Bosniak, please.
Thank you, Chair. Well, you'll be glad to hear that a great deal of my questions have already been answered now by Grace, so I feel slightly more comfortable. Just one additional question. Well, a couple really. I like the idea of someone who will go into communities, not necessarily work with the existing the existing groups, but also have the ability to create the support mechanism for people within the community. So it's not just going to your usual suspects, organised voluntary sector people who say, oh, I can do that, but being slightly more embryonic and looking at what can be created slightly differently. And it needs to then it needs to be something very, very different, I think. We have to think very differently to the way that the current voluntary sector is set up, what drives the voluntary sector. We've got some brilliant people within the voluntary sector who I consider to be very professional as well and very able. But we are looking at something slightly different here, and I think we need to be clear about that. What we can't do, however, is be open to the accusation that we're looking to do something on the cheap. In other words, the community doing it for themselves rather than social services offering a service. And it won't be that, I'm sure it won't be, but we need to be mindful of that accusation. I'm all for prevention, because in the long run it's not only about saving money for social care, but it's also doing what's in the best interest for that individual, and we need to keep talking about that rather than savings. However, this local area coordinator, will they also be responsible for monitoring the quality of the support the individual is getting? So we're not waiting for the end of the 2 years to assess whether it's been successful and whether we've saved any money, but more to do with ongoing support ongoing support for the group that's offering support as well. So they don't just set it up and leave it alone until there's an issue, but they are very much part of it, hands-on almost. So I think it's really exciting. I just think there's a few things we need to keep an eye on, which I'm sure you'll do anyway, but it's really an exciting prospect, and the notion of prevention is the best thing for everybody all around. So thank you, Chair.
Thank you, Joyce. Corporate Director Melanie Brooks, please.
Just to pick up on a couple of points, and your points, Councillor Bosniak, they won't be involved in monitoring individual support, so that's very much the role of the Department of Social Care, is making sure people's outcomes are being met. I think the bit that sets local area coordination apart from the CVS, the voluntary sector, the type of work that Community Catalyst do, is they're focused on the resources in that community and the person. A CVS will be looking to build voluntary sector capacity, and it will be building help, and it will want to build in services. The community development team in place has a specific role, but local area coordination is focused on that, the individual and their social care needs, and preventing the social care needs, so that it has that's what they're focused on. So just to pick up those points from Councillor Wise as well. So that's the bit that we'll be keeping our eyes on, to use your terminology. Joyce, is that we're making sure that that's what their focus is, and they're not getting distracted in trying to solve all of the other issues that might be, evident in a place, or because of voluntary sector capacity, or those bits. It's focused on those two things.
Thank you. Has that covered your question, Joyce? Thank you. Councillor David Martin, please.
Yeah, morning. Thank you, Chair. Thank you, Melanie and Grace. I welcome the paper, and I think it's a great idea, and I think it's a long time we've needed something like this to catch the people that fall through the cracks. And I particularly make reference to Grace's reference to settee surfers. Of course, most of those are inadvertently males between the age of 25 and 54, when the wheels have come off and they end up in a spiral, downward spiral, and have nowhere to go. And a lot of people, I'm talking about vulnerable adults and domestic abuse victims, don't know where to find that help. And I'm convinced it's a great thing, and I'm sure you will be checking and doing your checks and balances as it goes along. But hopefully, if it saves a dozen lives, it's worth the money. You know, thinking about going forward how we could access them, because I regularly make referrals to the adult health and social care team about adults for all sorts of various reasons that are having difficulties or experiencing problems, and I'm sure other councillors have too. So we could play a major contributory part in assisting that local area coordinator. Directing people to the right person would be a great thing for me, and a comprehensive net for somebody who's suffering from mental health issues or depression or domestic abuse or even homeless. I think it's a great thing, so I fully support the paper, and thank you for your due diligence in implementing this post. I think it's great. Thank you.
Thank you. We've got no other speakers, so I'll take it to the vote. Joe Toomey, please.
Thank you, Chairman. Councillor Bosniak.
For.
Councillor Dr. Doddy.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers.
For.
Councillor Wise.
For.
And Councillor Woodhead.
For.
Thank you. That's carried unanimously.
Thank you, Joe. We'll now move on to item 6, which is development of integrated care systems in Nottinghamshire and national consultation response. And you'll find that on pages 29 to 84 in your agenda pack. So this report summarises the Council's role in system leadership of health and care and the success of system working over the last year, and makes a recommendation on the level of partner contribution to the Nottingham and Nottinghamshire Integrated Care System, commonly known as ICS. The report also summarises the proposals of relevance to local government in the NHS consultation document, Integrating Care, Next Steps to Building Strong and Integrated Care Systems Across England. It highlights the key messages, questions and concerns, and provides the County Council's response to this consultation. The recommendations of the report are set out on page 36 of the agenda pack, and they are that the Adult Social Care and Public Health Committee 1. Reviews the progress made in the health and care system working across Nottinghamshire over the last year. 2. Agrees that no financial contribution to the Nottingham and Nottinghamshire ICS is made in 2021, and endorses the County Council's response to the consultation. So to debate it, I'll formally move it. Could I have a seconder, please?
Happy to second that. Thank you.
Councillor Elliott, thank you. And I'll now ask Corporate Director Melanie Brooks to introduce the report, please.
Thank you, Chair. Paragraphs 3, 4, 5 just really remind committee of the different statutory duties we have as a council, but also as individual statutory officers with myself, the Director of Public Health and the Director of Children's Services, in terms of system leadership and system working. So we just give a bit of reminder of that. And I think one of the areas that I think is quite topical and of note to this paper is the role the Health and Wellbeing Board has as a strategic commissioner to identify the health needs of the population and to drive the commissioning activity of the health system as well as the social care system in meeting those needs. So I think it's worthwhile just bearing that statutory duty in mind as we talk through the issues. The ICS members have heard updates from both the Bassett Law and the South Yorkshire Bassett Law ICS and the Nottingham and Nottingham ICS in the last number of years. So you've been hearing those updates certainly before I joined Nottinghamshire and through the time that I've been here. So hopefully you've got a bit of a flavour of what those activities are. In the main, the developmental side of the ICS has been suspended in the last 12 months because of the COVID response. But I think despite that suspension, there's been huge effort in bringing together the emergency planning and resilience activities of both health and social care, and indeed the wider system of housing, welfare, debt, employment. There's been a whole range of activities where the local resilience forum has truly taken a Nottinghamshire view of bringing together that emergency response, which I think will go a long way to seeing us through in terms of integration of services into next year. And we've summarised some of those highlights in paragraphs from 17 through to 23 on the things that I think will be worthwhile to continue as we move through that. As you all know, you've heard me talk many times about the care home and home care cell in the Local Resilience Forum and the strides we've made to bring together the CCG's quality response and our own quality response and nursing support from community health services to respond to the numerous and serious outbreaks we've had of COVID in care homes. So I think that's a sort of good example of some of that work that certainly we want to see exist into next year once we recover from COVID this year. The paper really talks about our response to the consultation. So in yellow pages, I've attached the consultation paper that was given by the NHS. It was really undertaken over the Christmas period. So over the festive period, we were asked to comment on that paper. And the paper made a proposal that the integrated care system, the ICS, is formed on a statutory footing and gave a number of options. So we considered our council response. That was informed by discussions within the ICS itself and the lead officers, the chair and the lead in both ICS systems. We had conversations with the leader, with Councillor Harper as chair of the board, and took a whole range of views into account for our response. And we summarised the response in the pages for you. Well, I think just to pull out together what I think are the key issues. So I think as a council, we'd want to suggest that we recommend and support that there is a statutory board that oversees the commissioning activities across the system. I think we recognise, however, that care isn't a subset of the NHS. It's a system in itself. So we have multiple systems in Nottinghamshire that aims to meet the needs of residents. So there's health system, there's a social care system for working age adults and older adults, there's a housing system, there's a debt and welfare and system. So there's these multiple systems and they all do overlap, and there does need to be some way of overseeing and bringing together some collaboration for the benefit of residents. So there's no doubt about that. I think certainly the views of many of the people I discussed this with, we were unclear in the consultation exactly how the ICS would bring about a better collaboration and how it would have some democratic accountability for commissioning on behalf of the residents. So we highlighted the fact that we'd like to see greater detail within that. So it'd be very difficult for me to advise committee on what that detail would look like because it wasn't in the paper. You may well have seen in the news over the weekend that the draft white paper was leaked over the weekend. So some of you may well have seen that there's a draft white paper and some of the contents of that. And I'm sure you'll have your views about that. So we are expecting that to be published this week. And in the style of most white papers, there will be some degree of consultation. So we can then, I think, as members of committee, consider further our response to the white paper. But we'd be looking really to see some of those questions we raised in the consultation answered. So what would be the statutory duty in the ICS, for example, to inequalities? So if they're going to have a role in closing that gap, how will that duty be shared with Health and Wellbeing Board? What will be the relationship of Health and Wellbeing Board? And will Health and Wellbeing Board be a part of the ICS, and will the ICS report to the Health and Wellbeing Board? I think that's something I'm hoping the white paper will address. And particularly, I think I'm really keen to see much more of a statement around accountability to people. So what is the role of co-production and accountability to individual residents, as well as democratic processes? So that's the sorts of issues that we commented on the consultation, and we look forward to the white paper addressing those concerns. So if you have any questions, very happy to answer them, but hopefully it was a bit of a canter through the paper for you.
Thank you, Melanie. I've got Councillor Muriel Wise, please.
Thank you, Chair, and thank you very much for Melanie for that report. I mean, there's absolutely no doubt that during the COVID period, the cooperation between ourselves and health has just improved enormously, and the Local Resilience Forum has done an amazing job at coordinating support. There's absolutely no doubt about that. But in other respects, I suppose the paper coming to social care today is a bit difficult in timing, since we've only had the, as you said, the media leaks of the white paper, and some of it not from my point of view, not particularly reassuring. I mean, there's been some excellent officer work being done through the ICS. One can see it happening at local levels. What's more concerning for me is the overall democratic accountability. Now, I appreciate that Tony is involved, but beyond that, structurally, we're still in danger of, as you say, being a subset of health. I mean, we set down, under David Pearson's leadership, we set down the standards of negotiation that we wanted fulfilling in terms of a respect for social care, and locally they have largely been kept to and respected. But it is concerning, and I know we're not answering this for the whole country, but it is concerning really that because of David's work and your continuing work and the work of the Manchester lead, we're probably the two authorities with the most robust partnership in the ICS. Nationally, that same partnership isn't necessarily played out. And in terms of, from a council point of view, in terms of being able to comment on, scrutinise the whole footprint of Nottinghamshire, as everyone knows, the Health Scrutiny Committee is very limited. We don't meet with the city councillors, so we only scrutinise the county's aspect of the work. So there seem to me serious elements still missing from a really robust integrated care system at a higher level, and I would certainly want to see much of that put into place and articulated, at least, before we support this present stage of things. Thank you.
Thank you, Muriel. Melanie?
Yes, I would agree, and I think it's just to note that in the paper itself, I'm not suggesting that we supported the options or a option or any of the questions in the consultation paper. It's just reporting to you the things that we put into the response to the consultation. And certainly what the other recommendation is that we don't make a financial contribution to the ICS for next financial year, because we give significant amount of officer time as an investment into that process, which I think is sufficient to meet the identified outcomes of the programme from a public health and adult social care perspective, because public health is an important aspect of this, which is why I sort of laboured the point about Health and Wellbeing Board and health inequalities.
Thank you. Thanks, Melanie.
Thank you, Muriel. Just from the democratic point of view, I mean, I can assure you that I play my part in the ICS, you know, so much so that I was on the selection panel for the new chairman of the ICS. And the other representative we have is the chairman of Health and Wellbeing Board, and it's very rarely that we both aren't there. So compared to some authorities, we do really well, and we do take part in it. Yeah.
Absolutely.
But unfortunately, this survey was dropped on us in the Christmas period. I can't think of a worse time to ask for a questionnaire to be filled in, to be honest, but we did it, and this is the result of it. So thank you for your comments, Muriel. I've got Councillor Joyce Bosniak, please.
Thanks, Tony. Oh dear, I must just share with you how frustrated I feel about all of this. Because I was involved with the Health and Wellbeing Board when it was first established, the whole idea of the Health and Wellbeing Board at that time was to bring people together. And I know that David Pearson used to smile and say, what we really need, Joyce, is the Nottinghamshire pound. So we had a clear idea of all the money we had in health, all the money in social care, and together determine how that money should be spent. And that might sound a bit utopian, but at least I felt we were moving towards something. And then we were sold the ICS on the understanding that this was going to make things leaner and meaner, there'd be no duplication. And yet what we seem to be putting in is yet another layer of bureaucracy, which, and I agree with Muriel, and I agree with you, Tony, I don't doubt for 1 minute that you're not playing your part on the ICS board, but it does smack of tokenism to me. They have the chair of health and wellbeing and the chair of social care. It's almost like a little nod to let's involve the elected members. It might keep them quiet for a while. And you know, forgive me for saying that, but that's how I feel. I think there's, as Melanie said, there's far too many unknowns in all of this that I couldn't possibly couldn't say where it's going. I'm really pleased that Melanie said that we'll be putting no money this financial year into the ICS, because I do think we contribute considerably in terms of resources, in terms of people and officers, and I'm not sure exactly what we're getting from it. We've achieved a lot working in partnership when we've had to, and everybody's got, and we've done that despite the ICS. We've done it because we know it's the right thing to do, and I think we do have strong partnerships. I would be concerned about the Bassett Law position. Are we saying that we make them now fit our footprint? We've wanted them inside all the time. Bassett Law decided to go with South Yorkshire. We allowed that to happen. And now are we saying, or is the government about to say, you bring them back in kicking and screaming? The city, like Muriel said, is an unknown quantity now. As I said, I find it frustrating. I feel as though yet again government's tinkering around the edges. We've got the white paper, but we're still waiting for a green paper that they've been promising for years now. I feel as though we're trying to work in the dark, and that is unfair. We're trying to make sense of it, and it's just unrealistic. I'm going to be abstaining on this paper because it doesn't give me the detail that I need at this time. And I look forward to the next time when we have a discussion about the white paper.
Thank you, Councillor Bosniak. I couldn't agree with you more with all of your points, really. One thing I will just cover in relation to Bassett Law, it's not us dragging them in, it's them pushing against the door to come and join us. But I'll allow Melanie, please, to give her feed on it.
Yeah, so what we understand is that the geography will be part of the changes being proposed in the process. So that's information that I have, is that geography is being reviewed, and that there are some commitments being made about there being coterminosity with upper tier local authorities. But that detail, it wasn't in the consultation papers. That's not something I'd be able to comment on. And as I said, I'm asking committee to approve the consultation response of all of those caveats, not the principles of supporting what the white paper suggested. And I think you're right, Joyce, in that it's not really clear what good would look like with democratic accountability, and that wasn't proposed in the yellow pages. So I'm hoping the white paper will start to address that. And I think the other thing for me that the consultation the yellow pages did was it confused some of the issues that the NHS does need to address. Some of the Lansley reforms that have got in the way of patient outcomes. So internal markets, for example, there's procurement rules. There's a whole lot of proposals that are about sorting the NHS system out so that there's more cooperation. And then I think there's a separate set of proposals about collaboration with strategic partners. And I think at times the two were interrelated in a way that didn't quite make sense to me or land. So I'm hoping again that those two issues are separated and dealt with in the white paper, but we'll see when that gets fully published.
Yeah, thank you.
Thank you. I've got Councillor Dr. John Doddy, please.
Yeah, thanks very much indeed. I would say that this is an incredibly astute paper, Melanie, in the way it sort of looks at the proposal, analyses and recognises instantly the gaps and the deficits in terms of representation of the County Council. So it would be, for me, the main reason to support it is that it recognises the deficits and the lack of detail, and I think that's what we want from a paper. I think other people have put forward the fact that we're now with an ICS a few years down the line, and like Councillor Bosniak, I mean, I was involved in the original board of the ICS. And there was all talk about a circle and 3.5 billion and moving it round in order to improve all aspects of the system. And the sad reality is that we remain with two parallel lines. We've got the parallel line of the NHS and we've got the parallel line of the county council and social care and public health and health inequalities, and never the twain shall meet. Nobody has actually put forward a valid picture that you could look at and see what does this look like in 3 to 5 years' time with regard to the movement of money around the system. I think COVID showed the interdependence of the NHS and social care, the dramatic need for care homes, residential care and nursing care in order to stop the NHS collapsing by having a system out there which could take the overflow and could take the discharges, however safely. And part of the ICS has to recognise that without putting monies through into the social care system to make it more robust, that ability to survive under stresses can be lost. For me, the thing that's going to happen is that the ICS looks incredibly acute in its outlook in terms of the NHS. It doesn't address social inequality. It doesn't address the fact that the West Bridgford person lives 7 years longer than the Ashfield person. It doesn't address the fact that most of the indicators for a healthy life from Marmot, etc. in 2010 is about housing, it's about environment, it's about social areas where people live, it's about education, all of which are provided by the county council and the borough councils, etc., and not by the NHS hospitals and the GP surgeries. And at the table, if we do not represent ourselves in a firm and robust manner and say a huge proportion of the ICS funding must flow across into social care, into health inequalities, into establishing communities, into providing a robust care service for people, then it becomes nothing more than what Councillor Bosniak was pointing to earlier, just another CCG NHS arm without actually involving the county council. So I'm going to say that, Melanie, I think that the paper astutely recognises the dangers. I think the paper astutely recognises the fact that if you don't have sign-off by health and well-being, etc., on all aspects of it, then that money will be swallowed up by acute and no health inequalities will ever be addressed and the lines will remain parallel. The recommendations are very, very firm. They're very demanding and saying that if we're at that table, we need to be making the decisions for the county council. And I think that the reality is that huge swathes of that money need to flow out of the ICS into county council, into social care, into the communities, into housing, into education, and that's our job, is to represent the people and make sure that occurs. I think the paper is very astute in recognising that, and I support it, but recognise what Councillor Bosniak said, we're recognising the gaps and the differences in it, rather than necessarily the completeness of the system. Thanks.
Thanks, John. Just to reiterate what you've just said, John, because you made a very salient point, as did Mel, that we're asking councillors to approve our views on the ICS, not on the principles of the ICS, and that is the important point to be made. Muriel, is yours a legacy hand, or is it in relation to what you've already spoke about?
It's a legacy hand. I do apologise.
That's all right, no problem. So if we can move to the vote then, please, Joe Toomey.
Thank you. Councillor Bosniak?
Abstain.
Oh.
I know, and I agree with what you said, John, but I just don't trust the government to just take it that way.
Okay.
Yeah. Councillor Dr. Doddy?
For.
Councillor Elliott?
For.
Councillor Fielding?
Abstain.
Councillor Harper?
For.
Councillor Martin?
For.
Councillor Purdue-Horan?
For.
Councillor Sissons?
For.
Councillor Vickers?
For.
Councillor Wise?
Abstain.
And Councillor Woodhead.
Abstain.
That's carried, 7 votes for and 4 abstentions.
Thank you. We'll now move on to item 7 on the agenda, which is the Public Health Performance and Quality Report for contracts funded with Ring Fence Public Health Grant, and the period is from the 1st of July 2020 last year to the 30th of September last year. So we're talking the period July to September last year. So the report provides an overview of performance for public health directly commissioned services and services funded either or in whole or in part by the Public Health Grant from July to September. A summary of the key performance measures is set out on the first page of the Appendix A. This performance report reflects progress during Q2 as the strictest lockdown restrictions due to COVID-19 were eased. The recommendation as set out on page 91 of the agenda pack is that the committee considers whether there are any further actions it requires arising from the information contained in the report. So to debate it, I'll formally move the recommendation. Do I have a seconder, please?
Second.
Seconded by Councillor Purdue-Horan. Thank you. And over to Natalie Burkitt, please, to introduce the report.
Thank you very much, Chairman, and I can just say good morning, committee. So as Councillor Harper stated, Q2 began as the first signs of lockdown restrictions being lifted were seen. At this time, Public Health commissioned providers were contacted to seek assurance that services could, as far as possible, be returned to some sort of normality. Many of our providers, especially those that rely on community venues and schools to provide face-to-face interventions, continue to face challenges, as unfortunately venues remain shut. Furthermore, there still seemed to be a bit of reticence from the public to attend these face-to-face sessions too. And those providers who have to provide face-to-face interventions, for example, our sexual health service, needed extra time for sanitisation and changing of PPE, which meant that actually less appointments were available. However, I can say providers continued to work innovatively, building on the lessons learned in full lockdown in Q1. Stakeholder engagement and the mental well-being of service users are probably two of the unquantifiable but nonetheless important outcomes providers are contributing to. I think the latter being indispensable during this time of isolation. An example of this is that the integrated wellbeing provider ABL, and I know committee had a presentation from them last month, they recorded over 100,000 contacts with service users. And whilst I'm jumping the gun slightly because that was for the first 3 quarters of this year, I think it's still an amazing achievement. And for those service users who started an intervention with ABL, the average number of contacts received is 26. So again, you know, we are seeing that providers are able to contact service users, and that contact has been invaluable. I'm going to keep it short, I'm aware of time, but I'm obviously very happy to take any questions members may have.
Thank you, Natalie. I've got Councillor Muriel Wise, please.
Thank you, Natalie. Firstly, just thank you for the report, that the white pages report that does really summarise very helpfully all the material in the yellow pages. That's really helpful to have a friendly summary. It's really helpful. I think I asked you this question in the briefing, and I'm sorry because I've forgotten. In terms of GP health checks, the payments were stopped during Q1 for understandable reason. I see that they were given again in Q2. Have we any idea yet if GPs were able to pick them up again, or have they become now involved in the vaccinations, and therefore their time has been taken up in other ways. And in that case, are the payments for the health checks going to be stopped again? And the other question is just a broad one. In terms of the equality duty implications, it says that monitoring of the contracts ensures that providers do comply with their equality duty. I mean, given our concerns about health inequalities, particularly during the vaccination period, are you happy about the ways in which health inequalities are being addressed in these contracts?
Thank you. Natalie, please.
Thank you very much, Councillor Weiss, for your questions. If I can just clarify about the payments in respect of health checks, what we actually did in Q1 was pay 80% of the amount that we paid in last year's contract for Q1 to GPs, in order to be able to help them with their finances and also to reflect the good work that they do and the fact that it was out of their hands that they were stopped basically from providing health checks in that Q1. In Q2, and we're always aware of government guidance on this, and we try and follow this as we can, and therefore in Q2 the decision was made to actually revert back to payments on actual activity, bearing in mind that GPs were still under huge pressure still in Q2, and therefore that is reflected unfortunately in the low numbers. But it was felt that paying them 80% probably wasn't right at that time, and as I say, we were following government guidance. In respect of the equality duty implications, especially in this year, we have very much tried to change our contracts. And for example, in our integrated wellbeing service, 40% of their outcomes have to come from areas of deprivation. And in that respect, I do feel assured that our providers are targeting those areas of deprivation more than they would, I think, as Councillor Doddy expressed earlier, more than they would possibly Rushcliffe. So yes, from that point of view, I'm assured. And also in respect of how our providers are allowing access to people from all areas of, so we monitor from our providers the types of people who are accessing, to ensure that older people from who have a different sexual orientation are accessing, people of different ethnic minorities are accessing our services, to ensure that actually across the board, from that point of view too, our providers are definitely ensuring that their equality duty is being met.
Yeah, thank you, Natalie. I didn't want to disturb the flow of your presentation, but Councillor Muriel Wise, could you stop sharing your screen, please?
I think I have tried to get rid of it. Has it gone now?
No, it's still there.
Next to the mute button, Muriel, you should see a little symbol and it will say stop sharing. If you try that one.
That's it. Well done. Thank you. Councillor John Doddy, please.
Thanks very much. It's when a screen share comes up like that, nobody knows who it is. I thought I was scrambling there to see if it was me, Muriel. Yeah. It's quite confusing.
I do apologise.
No problem. I think that it was nice that 1 quarter of income for the NHS checks was protected, but subsequent to that, no further quarters have been protected. And I think health checks have gone down the pecking order quite a bit. In terms of when you look at the achievements of public health, one of the things that stood out last week was the fact that the figures for deaths from alcohol consumption had been the highest number of alcohol-related deaths in history. From my point of view, on a daily basis, the single biggest thing that I see coming through the door are pre-diabetics and diabetics, which are largely around obesity, which are largely around eating habits, largely around lockdown, and there's a phenomenal daily increase. I've never seen anything like it in people who are pre-diabetic. That means that they're at danger of becoming a diabetic, and those who've actually gone from being at danger to actually being diabetics. That's on top of all of the other things that you recognised earlier, Natalie, about isolation and mental health, etc. To me, the challenge going forward will not be to perform well as a public health department. It'll be to even remotely drag us back to where we started a year ago, to have even the basic successes that we had back then. And I think that the input, etc., that will be required over the next number of years to recover people back to where we started from is incredible and only just beginning. The sheer scale and mammoth task to recover the health of the population separate to COVID is extraordinary. What is the likely possibilities, Natalie, that substantial funds will be released in addition to existing ring-fenced budgets for public health in order to allow us to get back to any form of normal health for the public, which I think is in a disastrous state at the moment? Thanks, Natalie.
Thanks, John. Natalie, please. I think you're muted, Natalie. We've all done it.
Sorry. Thank you for that, Councillor Doddy. I have to say, I hope that we don't go back to where we started. I do hope that there's going to be an improvement. I can't say whether there's going to be additional funds, but actually, from the conversations I'm having with providers, they are so keen to get back out there to actually do the work that we've commissioned them to do. And they know that they haven't met our targets for this year. And whilst, you know, we fully understand the reasons why, and they provide us assurance time and time again that actually they are doing the very best they can under the circumstances. I honestly feel that, yes, it may take a few months, I'm not going to lie. And this year, I'm kind of writing off from a data kind of point of view, but I do hope that, you know, a few months into the next financial year, we will definitely see a turnaround. Again, I don't want to kind of take away my thunder from reports that are to come, but I know, again, our integrated wellbeing provider is almost reaching the target for smoking cessation that we had in a full year in normal circumstances under our previous provider. So that's a great news story, which, as I say, I will hopefully be reporting on in future committee meetings. And also, actually, you talk about alcohol deaths. The work that both CGL, our substance misuse provider, and ABL together, and this again is a new and, well, it's working better, should I say, the fact that our providers, our commission providers, are working together to ensure that outcomes are met, and alcohol is definitely one of our priorities. So again, we are hopeful in that. In respect of your increase in pre-diabetes, diabetes due to obesity, the numbers are at the moment quite disappointing. That's not to say that the work isn't being done, but it's very difficult to, for example, the sessions that would normally happen face to face just haven't been able to happen, and so there is, I suppose, some work to be done there. And I know that ABL are trying to do that work and know where they're failing and know where they need to step up. So to go back to my first comment, I don't want to go back to where we started. I want to do even better.
Thank you.
Thank you, and thank you for your enthusiastic reply, Natalie.
Yes.
Fill us all with confidence. Thank you. I've got no more speakers, so we'll take it to the vote. So, Jo, please.
Thank you. Councillor Bosniak. For. Councillor Dr. Doddy.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers.
For.
Councillor Wise.
For.
And Councillor Woodhead.
For.
Thank you. That's carried unanimously.
Thank you, Jo. We'll now move to item 8 on the agenda, which is the Better Care Fund Dementia Project Support Post. And you can find that on pages 95 to 98 in your pack. So this report seeks approval for the establishment of a 0.8 FTE Public Health Support Officer post, Band B, for 12 months, funded by Better Care Fund, BCF. The purpose of the role will be to coordinate a project to develop a standardised format and improve the uptake of advanced care plans by people living with dementia across Nottinghamshire. The outcome of which will be to embed this process across the health and social care system. Dementia and compassionate end-of-life care are part of the Nottinghamshire Health and Wellbeing Strategy. Advanced Care Planning, ACP, allows people to record their wishes about future health, care and life choices before their mental capacity is lost. Nationally, evidence shows that uptake of ACP by people living with dementia is poor, and this is reflected in local data with less than 20% uptake across the Nottinghamshire Integrated Care System. In January 2020, BCF Reserves funding of £45,000 for 12 months was awarded to the Public Health to support the Nottinghamshire County Dementia Declaration Action Plan and the work of the Nottingham and Nottinghamshire ICS Dementia Steering Group. The majority of the funding will be used to recruit a public health support officer to provide additional capacity to coordinate the delivery of the project. I'll now move the recommendations as set out on page 98 of the agenda pack, which are that the committee approves a 0.8 FTE Public Health Support Officer post, Band B, for 12 months, funded through the Better Care Fund reserves. I've moved the recommendation. Could I have a seconder, please?
Happy to second that.
Councillor Boyd-Elliott, thank you. Over to Kath Pritchard and I think Melanie, thank you.
Thank you for that introduction, Councillor Harper. So as the paper mentions, originally the details around the whole of the Better Care Fund were brought to yourselves in January 2020. Due to COVID, we had to pause this piece of work on advanced care planning. So we're bringing it back to you now in the hope that we can move forward in relation to this important area of work. So this is particularly important for not just the individuals with dementia, but also their families and support structures. Advanced care planning gives the opportunity for those conversations to be had to ensure that people communicate clearly what they're wanting for their future life and to help them make decisions in relation to both health and social care. So the paper in front of you is a request for monies from the Better Care Fund pot for us to help a 0.8 whole-time equivalent Band B Public Health Support Officer. And their role will be to help develop a one system approach for advanced care planning. We will work together with people with lived experience to enable us to understand what questions need to be asked and what the best format for this is. So that's a brief précis of the paper. I'm obviously very happy to take any questions that councillors may have in relation to this paper. Thank you.
Thank you, Kath. I've got Councillor Sybil Fielding, followed by Councillor David Martin and Councillor Muriel Wise. So Sybil, please.
Thank you. Thank you, Chair. I very much welcome this paper. It is vastly important that you get the timing of this right, and I speak from absolute experience, because it was too late as far as my father was concerned to have these conversations. But we ensured that with mother, who's got severely advanced Alzheimer's now, that we had these conversations at a stage when she could input what she wanted further along the line, and we've got great clarity now of what her wishes are, even though she now isn't able to voice them with the same clarity. But as I say, I welcome that we're going to have this moving forward, so that other families will have the help and support at the time that they need it, to ensure that people's wishes are adhered to.
Thank you, Councillor Fielding, and I can understand. I've been through something very similar as well, where it was too late. The intervention was too late, and we never did get to know the real wishes. So I do understand what you're saying on that one. Kath, please.
Yeah, thank you for sharing those sort of very personal and lived experiences from both yourself, Councillor Fielding, and Councillor Harper. And I agree with you. It's about having those early conversations, which are difficult. I don't think we should take away from the fact that they are difficult conversations to have with individuals, and yet knowing what people want, and also providing that support and reassurance for families, friends and carers moving forward, that they are indeed carrying out an individual's wishes. I think it needs to be seen in both of those contexts of both the individual, but also their families and carers helping to support individuals. So thank you for sharing your experiences.
Thank you. I've got Councillor David Martin. David, please.
I think it was Muriel before me.
Muriel, then you're next on my list, but if you give him way, I'll let Muriel go. Thank you.
Okay, yeah, just a brief comment. Thank you, Catherine, for the report. It's a really good use of the Better Care Fund. We had a presentation from NUS at Health Scrutiny recently about their efforts to make better use of the passport information from families where a member of the family with dementia has been admitted to hospital. I would just hope that when this is developed, that the system does really strengthen the pathway of the information being used when people are admitted to hospital. Yeah, I think sometimes the questions on admission for someone with dementia are really very positive and helpful. At other times, they don't exist. So I think this piece of work is an opportunity to provide families with something that they can share with hospitals when people are admitted. Thank you.
Thank you, Muriel. Kath, do you wish to comment on that one?
Just to add an additional bit of context, if it's helpful. So this piece of work has been worked with the ICS as well. So it's not just about Nottinghamshire County, it is about that partnership approach. So hopefully that provides a degree of reassurance that we are trying to integrate this work across health and social care systems. Thank you.
Thank you. Councillor David Martin, please.
Thank you, Chair. Yeah, I welcome this paper, and I do think it's a very important piece of work about very difficult conversations. I've helped at least half a dozen residents from both sides of the fence here, to straighten the pathway, because it's a difficult thing, because people with obviously it's a degenerative disease, and people can often slip away faster than people realise, and relatives and family members are reticent sometimes to make the right decisions or to ask those questions. So it's a very, very good piece of forward planning, this, and I welcome it, because it's like Muriel and Councillor Harper have alluded to. Once it's gone, and you can't ask those questions again. And it's a very important piece. I welcome it. Thank you.
Thank you. I've got Councillor Joyce Bosniak. Joyce, please.
Just a quick question. I don't know, drawing on my own personal experience, I suppose. My mother-in-law, if you try to have the conversation with her very early on when she started to get dementia, when she was starting to lose her memory, and she knew that that was happening, and some of her behaviour was quite bizarre. And when we did say, well, what shall we do? She says, I'm not leaving my home. I'm not leaving here. And just about everybody would say, no, I'm staying at home. You're not putting me in a home, that kind of thing. And that is quite stressful as well, because we all know at the end, towards the end, when they get so bad that they can't possibly live in their own home, we're doing it, even though they said they didn't want it. So realistically, we know that we're asking them what they like, but we know there'll come a point when their decision is not for them to make anymore. So, you know, let's not kid ourselves. If I say you're not putting me in a home, I know at some point you're going to think, well, it's in your best interest, Joyce, so you're going in a home. But I actually welcome the fact that you're trying to get people to have the conversation in the first place, because it is so difficult.
Thank you, Joyce, and I think that's really key. What you've just said, actually, that's the key of it. Kath, do you want to comment on that?
No, you're absolutely right. That reality check about people's wants and needs, and they will change over time. So even if we can help in the immediate short term, so whilst an individual wants to stay at home, would they be willing to have additional support in the home, and how might that look in those early stages? It may be that you can only go to a certain point with those decisions, and I appreciate at certain stages when people are unable to take those decisions for themselves, different things may have to kick in. So you're right, that conversation indeed is not for everyone as well. Some people find it just too difficult a conversation to progress and move forward on. Thank you.
Thank you, Kath. I've got no more speakers, so we'll move to the vote. Jo, please.
Thank you. Councillor Bosniak.
For.
Councillor Dr. Doddy.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers.
For.
Councillor Wise.
For.
And Councillor Woodhead.
For.
Thank you. That's carried unanimously.
Thank you. We'll now move to item 9 on the agenda, which is the work programme. So the recommendation of the report as set out on page 100 of the agenda pack is that the committee considers when any amendments are required to the work programme. So I'll formally move the recommendations. Do I have a seconder, please?
Happy to second that, Chair.
Thank you.
Sweet.
That was Councillor Elliott.
Yeah.
Jo, are there any changes to the work programme arising from our discussions today? I think there might have been one from David Martin, but I know you keep a better tab on it than I do.
Yeah, the one thing we've got to pick up from today's meeting is about the arrangements for gifting and lending for the digital equipment.
Yeah.
Thank you. Any comments or questions? Anything else anyone wants to add? Something that they've got a burning issue they would like us to debate? No, thank you very much. So we'll now move to the vote. Jo, please.
Thank you. Councillor Bosniak. Paul. Councillor Dr. Doddy. Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin.
For, Jo, it was just the appendix on the other items as well, on that same paper.
Okay. Oh, yeah, apologies. Councillor Purdue-Horan. Councillor Sissons.
4.
Councillor Vickers.
4.
Councillor Wise.
4.
And Councillor Woodhead.
4.
Thank you. That's carried unanimously, but just to pick up the point that Councillor Martin made about the appendix for the original item, we've picked that up as an action, so you can receive all that information as well. So it will be noted, but as an action rather than necessarily part of the work programme.
Thank you.
Thank you, Joe. That concludes the business of the committee today. Thank you everyone for all of your input. I do appreciate that. And thank you for everyone for attending. So may I take this opportunity to thank any viewers for their interest in the meeting and to wish you all away, and please keep safe. Thank you. Please end the broadcast.
Thank you.
Thank you, Chairman.
This winter, more than ever, with COVID-19 still circulating, we need help to reduce all avoidable risks. You can help protect the NHS, social care and loved ones by getting the flu vaccine. You may be eligible for the free vaccine at your GP or local pharmacy if you are over 65, pregnant or have a long-term condition. Find out if you are eligible at nhs.uk/staywell. Children up to year 7 can get the free nasal spray at school or through their GP if they are below school age. If you are not eligible for the free vaccine, you can pay for it at your local pharmacy. The flu vaccination does not give you flu. It reduces the risk of catching flu as well as spreading it to others. If you had the vaccination in the past, that will not protect you as the flu strain changes every year, so you need to have a new one this year. It is also important to wash your hands often with warm water and soap. Use tissues when you cough or sneeze, and bin used tissues as quickly as possible. Thank you for helping to protect yourself and loved ones this winter.